Hello, I'm Dr. Maurie Markman from City of Hope, and I would like to briefly discuss something I don't normally talk about, which is preclinical data, but really quite provocative data that one can certainly use appropriately so in discussions with patients receiving chemotherapy regarding potential risks that the therapy may not be as effective as it should be because of behaviorals. Okay. Let me explain. So the paper was published recently in the International Journal of Molecular Sciences. The paper is entitled "Exposure to Secondhand Smoke Extract Increases Cisplatin Resistance in Head and Neck Cancer Cells." Now, I'm not a laboratory scientist and certainly not an expert in the pharmacology and toxicity of drugs against tumors in vitro systems. And I have to assume that the authors and the reviewers and the editors were correct in the assumptions they made, including the level of smoke, the level that might be achieved in the blood of an individual who was exposed to secondhand smoke. But the bottom line here is, assuming these assumptions are correct, and I have no reason to believe they're not, these data demonstrate, to me quite convincingly, that the concentrations of the extract material in this smoking can significantly decrease the ability of cisplatin to kill tumor cells in this model. And if this is even realistically possible to be translated into the human condition, one can argue that if you're a patient with a head and neck cancer receiving platinum, or potentially other tumor types, germ cell tumors, gynecologic malignancies, for example, where cisplatin remains today's standard of care, and you have a loved one near you who is smoking, or family and friends near you smoking, while you're being treated, the effectiveness of that treatment may be diminished significantly to your detriment. So, is this simply another very strong reason not to smoke, not to be around people who smoke, to encourage your loved ones not to smoke ever, but certainly not around you? I encourage you to read this paper, very provocative, concerning, and one more reason we should not have smoking. And I thank you for your attention.